Welcome to another episode from the Veterinary Research Channel. Today, we delve into the fascinating world of a medication widely used in veterinary medicine and explore its potential applications in human cancer therapy. The compound we are discussing is called fenbendazole. Fenbendazole is a well-known anthelmintic agent, which means it is used to treat parasitic infections in animals. You might be familiar with its use in dogs and various other animal species. Interestingly, in human medicine, there are other benzimidazole drugs, such as mebendazole and albendazole, that serve a similar purpose in combating parasitic infections. However, fenbendazole itself has not yet received approval from regulatory bodies like the Food and Drug Administration in the United States or the European Medicines Agency. Consequently, detailed information regarding its behavior within the human body, specifically its pharmacokinetics, how it is absorbed, distributed, metabolized, and eliminated, and its safety profile in humans is still limited in the established medical literature. Despite this lack of formal approval for human use, valuable insights into how fenbendazole might act in the body can be gleaned from existing scientific investigations conducted on cells in laboratory settings and in living animal models. Considering the relatively low cost of fenbendazole, its apparent high level of safety in animals, its general accessibility, and the intriguing evidence suggesting it possesses unique properties that can hinder the growth of cancer cells, there is a growing interest in exploring whether fenbendazole could become a beneficial treatment for cancer in humans. In fact, based on these promising characteristics, some researchers believe that fenbendazole might even be the preferred benzimidazole compound for this purpose. However, it is paramount to prioritize patient safety. Therefore, before fenbendazole could ever be considered for routine use in cancer therapy, it is absolutely essential to conduct rigorous clinical trials in humans. These trials would be designed to thoroughly evaluate its potential effects against cancer, determine the most effective and safe dosages, establish appropriate treatment schedules, and carefully assess how well patients tolerate the drug. This review that we are discussing today primarily concentrates on understanding how orally administered fenbendazole behaves within the body, its pharmacokinetics, and the encouraging anti-cancer biological activities that have been observed in published experimental studies. These activities include its ability to interfere with the way cancer cells produce energy by inhibiting a process called glycolysis, its capacity to reduce the uptake of glucose, a primary fuel source for cells, its induction of oxidative stress within cancer cells, and its promotion of programmed cell death, a process known as apoptosis. Furthermore, this review also takes a close look at the reported safety profile of fenbendazole and discusses potential strategies for improving how well the drug is absorbed by the body, enhancing its effectiveness against cancer, and minimizing any potential toxic effects. Chemically, fenbendazole is also known as methyl N-6-phenylsulfonal 1H benzimidazole 2YL carbamate. As mentioned earlier, its current primary application is as a therapeutic agent against parasitic infections in dogs and various other animals. The way fenbendazole combats parasites is mainly by acting in the anterior part of their intestines. Its primary mechanism of action involves disrupting the formation of microtubules, which are essential structures within cells, and inhibiting the transport of secretory vesicles in the intestinal cells of the parasites. Specifically, fenbendazole binds to a protein called beta-tubulin in parasites. This binding action leads to the destabilization of microtubules and hinders the process of tubulin polymerization, the building of these crucial cellular components. This disruption of microtubule function impairs various cellular activities, including the uptake of glucose, thereby significantly affecting the energy management of the parasites. Interestingly, due to its limited absorption when given orally, fenbendazole is particularly effective at targeting parasites that reside in the intestines. In an intriguing turn of events in August 2016, fenbendazole unexpectedly gained global attention as a potential anti-cancer therapy. This surge of interest followed the widely reported story of Joe Tippins, who experienced a complete recovery after being diagnosed with small cell lung cancer. At the time of his diagnosis, Mr. Tippins was participating in a clinical trial for a novel anti-cancer drug. Alongside this conventional treatment, and under the guidance of a veterinarian, Mr. Tippins began self-administering 222 milligrams of oral fenbendazole daily. His regimen also included vitamin E supplements, CBD oil, and a bioavailable form of curcumin. After approximately 3 months of this self-administration, a positron emission tomography scan, commonly known as a PET scan, revealed no detectable cancer cells in his body. Remarkably, among the 1,100 participants in the clinical trial Mr. Tippins was enrolled in, he was the only individual who experienced a complete cure from cancer. While the case of Joe Tippins is certainly compelling and has fueled much of the current interest in fenbendazole for cancer, it is important to recognize that it remains a single, anecdotal report. This solitary instance, however remarkable, strongly emphasizes the critical need for well-designed and rigorously conducted clinical trials to definitively validate both the effectiveness and the safety of fenbendazole as a therapy for cancer in humans. Moving beyond this individual case, scientific investigations have explored the anti-cancer activity of fenbendazole across a wide range of cancer cell lines in laboratory settings, demonstrating its ability to exert anti-tumor effects against multiple types of cancer. Furthermore, fenbendazole has shown promising efficacy against cancer cells that have developed resistance to commonly used chemotherapy drugs, such as 5-fluorouracil, paclitaxel, and docetaxel. Notably, in studies comparing fenbendazole to another benzimidazole anthelmintic, albendazole, fenbendazole was found to be more effective against colorectal cancer cells that were resistant to 5-fluorouracil. This enhanced effectiveness is believed to be related to fenbendazole's ability to interfere with the process of glycolysis in these resistant cells. Despite these encouraging anti-cancer effects observed in experimental settings, studies have also indicated that fenbendazole's poor solubility in water presents a significant hurdle that has limited its therapeutic performance. When administered orally, fenbendazole struggles to be adequately absorbed into the bloodstream and subsequently reach systemic circulation at the therapeutic concentrations necessary to have a significant impact on tumors. Addressing these pharmacokinetic limitations, the challenges related to how the drug moves through the body, is therefore crucial if fenbendazole is to be successfully repurposed as a treatment for cancer that can target tumors throughout the body. The scientific community has been actively investigating the various mechanisms by which fenbendazole exerts its anti-cancer effects. Research suggests that these mechanisms include enhancing the activation of a crucial tumor suppressor protein called p53, inhibiting a glucose transporter protein known as GLUT1, and blocking an enzyme called hexokinase, ultimately leading to a reduction in glucose uptake by cancer cells. It is well established that enhanced glycolysis, the process by which cells break down glucose for energy, is a significant characteristic of tumor progression. Under conditions where oxygen is limited, glycolysis produces lactate, which can increase the acidity of the environment surrounding the tumor. This increased acidity can unfortunately contribute to the development of drug resistance in cancer cells. Furthermore, metabolic disturbances, such as the excessive consumption of an amino acid called glutamine, can further boost glycolysis, creating a self-perpetuating cycle that promotes tumor growth. Studies have shown that fenbendazole can effectively inhibit the uptake of glucose by cancer cells, which in turn leads to reduced levels of lactate production. This ability to disrupt cancer cell metabolism suggests that fenbendazole could be a valuable treatment strategy, particularly for cancer cells that have become resistant to conventional drug therapies. Beyond its effects on glucose metabolism, fenbendazole exhibits several other mechanisms that contribute to its anti-cancer properties, primarily by disrupting the way cancer cells manage their energy. It acts as an agent that destabilizes microtubules, which are essential structural components within cells. It has also been shown to impair the function of the proteasome, a cellular machinery responsible for protein degradation, and directly inhibit the metabolism of glucose. Glucose, as the primary source of energy for tumor cells, is transported across the cell membrane by the GLUT1 transporter and then metabolized through a process known as aerobic glycolysis. Unlike normal cells, cancer cells often perform glycolysis to break down glucose into lactate, even when oxygen is readily available. While aerobic glycolysis is not a particularly efficient way of generating energy and appears to produce less adenosine triphosphate, or ATP, the main energy currency of the cell, compared to another process called oxidative phosphorylation, it provides essential building blocks for tumor cell growth, such as nucleotides, amino acids, and lipids. Moreover, the ratios of ATP to adenosine diphosphate, or ADP, and nicotinamide adenine dinucleotide plus hydrogen, or NADH, to its oxidized form NAD+, often remain high in tumor cells, indicating that their glycolytic metabolism is sufficient to supply their energy needs. The GLUT1 transporter is often found at high levels in various human cancers, including in a large percentage of patients with squamous cell carcinoma and adenocarcinoma. This overexpression has led to the suggestion that GLUT1 could be a promising target for the development of new cancer therapies. Interestingly, fenbendazole has been shown to induce the movement of p53 protein to the mitochondria, the powerhouses of the cell. This translocation suggests an activation of the p53-p21 pathway, which in turn can inhibit the expression of the GLUT1 transporter and prevent the uptake of glucose in cancer cells. Through this activation of p53, Fenbendazole is also believed to interfere with the activity of hexokinase 2, or HKII, which is the first enzyme in the glycolytic pathway and is considered critical for the growth of cancer cells. However, it is worth noting that one study did not observe an inhibition of HKII activity at certain concentrations of fenbendazole. Given that HKII plays a primary role in glucose metabolism, its inhibition would be expected to hinder tumor development. Therefore, the precise ways in which fenbendazole affects HKII warrant further investigation. Nevertheless, by targeting GLUT1, HKII, and the overall process of glycolysis, fenbendazole has the potential to effectively starve cancer cells of their primary energy source and potentially overcome drug resistance, thus aiding in cancer treatment. In addition to its inhibitory effects on glycolysis, fenbendazole has been shown to induce apoptosis, or programmed cell death, in cancer cells. In colorectal cancer cells, for example, fenbendazole triggers this cell death through damage to the mitochondria and activation of a specific pathway involving caspase-3 and PARP proteins. In colorectal cancer cells with a normal p53 protein, fenbendazole activates p53-mediated apoptosis by increasing the levels of p53 expression. Furthermore, it can also induce other forms of cell death, including necrosis, autophagy, and phoroptosis. Notably, in colorectal cancer cells that have become resistant to the chemotherapy drug 5-fluorouracil, fenbendazole can still trigger apoptosis without affecting the expression of the p53 protein. It is believed that in these resistant cells, fenbendazole likely enhances a form of cell death called p53-independent phoroptosis-augmented apoptosis. Fenbendazole also functions as an agent that destabilizes microtubules. Microtubule-targeting agents are considered promising in cancer treatment because microtubules play crucial roles in various cellular processes, including cell division, maintaining cell structure, and other essential events. Some anti-cancer drugs work by inhibiting the polymerization of microtubules, while others stabilize them, both leading to cell death and disrupting the cell cycle. Fenbendazole has demonstrated the ability to depolymerize microtubules in human cancer cell lines and has shown anti-cancer effects in both laboratory and animal studies. It has been observed to cause cell cycle arrest, specifically at the G2/M phase, which is a critical point in cell division. Furthermore, studies have shown that fenbendazole exhibits microtubule destabilizing activity at concentrations of 1 and 10 micromolar, with higher concentrations leading to a more pronounced cell cycle arrest. When administered orally at micromolar concentrations, fenbendazole has been shown to induce cytotoxicity, meaning it is toxic to cells and effectively blocks the growth of cancer cells. Fenbendazole can also cause oxidative stress within cancer cells and activate a signaling pathway known as MEK3/6P38 MAPK. This activation further inhibits the proliferation of cancer cells and enhances their programmed death. Importantly, fenbendazole appears to be less toxic to normal, healthy cells while still maintaining its anti-cancer effects of disrupting energy metabolism and limiting the ability of cancer cells to migrate and invade other tissues. Beyond its potential in oncology, fenbendazole has also shown promise in treating pulmonary fibrosis, a lung disease characterized by scarring, by inhibiting the progression of bleomycin-induced lung fibrosis in animal models. Given that fenbendazole has not been approved for regulatory use in humans, comprehensive pharmacokinetic data for this drug in humans is limited. While no formal clinical trials have specifically tested fenbendazole in humans, valuable insights into how the drug might behave can be inferred from laboratory studies and investigations in living animal models. It is noteworthy that the Food and Drug Administration has recently granted a fast-track designation for the development of oxfendazole, which is a major metabolite of fenbendazole, as a treatment for human trichuriasis, a parasitic worm infection. Pharmacological studies of oxfendazole in humans can potentially help to supplement our understanding of fenbendazole's pharmacokinetics in humans. Within the body, fenbendazole undergoes partial absorption, primarily in the liver. Here, it is rapidly metabolized by enzymes such as flavin monooxygenase and CYP3A4 to form its sulfoxide derivative, known as oxfendazole or fenbendazole sulfoxide. Additionally, other enzymes, CYP2J2 and CYP2C19, are involved in metabolizing fenbendazole into hydroxyfenbendazole. Another metabolic pathway converts fenbendazole into fenbendazole sulfone through both pre-systemic and systemic metabolic processes. Although fenbendazole sulfone is often the predominant form found in the plasma after administration, it is generally believed that oxfendazole is the primary metabolite responsible for the biological activity of fenbendazole. Interestingly, through systemic metabolism, oxfendazole can be reduced back to fenbendazole, rather than undergoing first-pass metabolism in the liver initially. Studies in male rats have shown that the maximum concentration of fenbendazole in the bloodstream after oral administration was relatively low. Following metabolism in the liver, fenbendazole and its various metabolites are primarily eliminated from the body via the feces and urine. Due to its low solubility in water and limited ability to permeate biological membranes, fenbendazole often struggles to reach systemic circulation at levels high enough to effectively impact tumors throughout the body. Its rate of release from typical oral formulations can also be relatively slow. In animal studies, fenbendazole has generally demonstrated a high margin of safety and low toxicity. A safety study in cattle found that fenbendazole was well tolerated even at doses 6 times higher than the prescribed amount, and for a duration 3 times longer than recommended. In rodents, the lethal dose, known as LD50, was found to be greater than 10 grams per kilogram of body weight, which is approximately 1,000 times the typical therapeutic dose. Lifetime studies in rats did not indicate any adverse effects on mothers or their offspring, no reproductive toxicity, and no evidence of cancer development. However, some morphological changes, such as an increase in the size and number of liver cells, were observed. Oxfendazole, a major metabolite of fenbendazole, has also been studied for its safety in humans and appears to be well tolerated. A randomized, double-blind, placebo-controlled phase I study involving healthy participants evaluated the safety of increasing oral doses of oxfendazole, ranging from 0.5 to 60 milligrams per kilogram of body weight. The study concluded that oxfendazole had acceptable safety and tolerability profiles, even after repeated daily doses up to 15 milligrams per kilogram for 5 consecutive days. This clinical trial also provided information on how fenbendazole is processed by the body, describing its disposition as a one-compartment model with elimination that is limited by the rate at which it is formed. However, it is important to note that while studies on oxfendazole's pharmacokinetics can provide some insights into the safety of fenbendazole, oxfendazole itself has a much higher solubility in water compared to fenbendazole. This difference in solubility means that oxfendazole can achieve much higher levels of exposure in the body even after the same oral dose, highlighting the need for specific clinical studies using fenbendazole itself to accurately assess its safety, toxicity, and appropriate therapeutic doses in humans. A significant challenge in utilizing fenbendazole for systemic therapies, such as treating widespread cancer, is its inherently low solubility in water and its limited bioavailability, the extent to which the drug is absorbed and reaches the bloodstream. Improving the water solubility of fenbendazole is essential because it would potentially reduce the amount of drug needed to achieve the same therapeutic effect. With increased solubility, fenbendazole might also be able to reach the concentrations required for it to be effective as a systemic anti-cancer drug. Consequently, several research groups have investigated various methods and delivery systems to overcome this low solubility barrier. These strategies include encapsulating fenbendazole in nanoparticles made of biodegradable polymers, complexing it with agents like cyclodextrins, and formulating it as co-crystals with other pharmaceutical excipients. For instance, complexing fenbendazole with methyl beta-cyclodextrin has been shown to dramatically increase its water solubility. Similarly, formulating fenbendazole as co-crystals with salicylic acid has significantly improved its rate of dissolution. The use of solvents like dimethyl sulfoxide, or DMSO, has also been explored as a way to enhance the solubility and potentially the bioavailability of fenbendazole. Despite the current lack of regulatory approval and the need for extensive clinical trials, it is noteworthy that some cancer patients have, as documented in case studies, self-administered fenbendazole. These reports, while not providing definitive scientific evidence, offer real-world observations on the use of this drug in humans with cancer. Some case reports describe instances where fenbendazole use was associated with a reduction in tumor size. However, it is crucial to also acknowledge reports where patients experience drug-related hepatic dysfunction, indicating potential liver toxicity, although in both reported cases, liver function recovered rapidly once the use of fenbendazole was discontinued. Interestingly, the published case reports often describe a consistent pattern of self-administration, typically involving taking approximately 1 gram of fenbendazole orally once daily for 3 consecutive days, followed by a 4-day period without treatment. However, it is critical to reiterate that the use of fenbendazole for cancer therapy in humans remains experimental and requires further carefully designed pilot studies and extensive clinical trials to establish effective and safe doses and treatment regimens. Patients who have pre-existing conditions affecting their liver function, such as liver cirrhosis or liver cancer, should exercise extreme caution if considering the use of fenbendazole. Furthermore, Some researchers suggest that combining fenbendazole with other agents that inhibit glycolysis or with substances that can protect the liver might potentially lead to enhanced therapeutic activity while mitigating the risk of liver toxicity. There is also evidence from animal studies suggesting that combining fenbendazole with supplementary vitamins might enhance its anti-tumor effects. Additionally, it has been suggested that taking fenbendazole with food may improve its absorption into the body. In conclusion, the disruptive effects of fenbendazole on the energy metabolism of cancer cells represent a compelling and promising area of scientific investigation that could potentially lead to significant advancements in the treatment of cancer. Numerous studies conducted on cancer cell lines in the laboratory and in living animal models have demonstrated the efficacy of fenbendazole in inhibiting tumor growth and targeting cancer cells that have become resistant to conventional drug therapies, largely through its interference with glycolysis. By increasing the expression of the p53 protein and by acting on multiple cellular pathways that involve the GLUT1 transporter and the hexokinase 2 enzyme, fenbendazole appears to effectively downregulate the uptake of glucose by cancer cells, essentially causing them to starve and ultimately enhancing their programmed cell death. Importantly, this mechanism seems to allow fenbendazole to selectively eliminate cancer cells while exhibiting little to no significant toxicity to normal, healthy cells. Recognizing the limitations posed by fenbendazole's poor solubility, ongoing efforts to improve its solubility are crucial for enhancing its bioavailability and reducing the amount of drug needed to achieve therapeutic concentrations within the body. Future research could focus on directly comparing the effectiveness of different drug delivery vehicles and testing a range of concentrations to optimize fenbendazole solubility and its rate of release into the bloodstream. Moreover, exploring the potential benefits of combining fenbendazole with pharmaceutical agents, nutraceuticals, and glycolysis inhibitors that also have hepatoprotective properties could represent a promising strategy for improving the drug's overall effectiveness while minimizing its potential for reversible liver toxicity. Given its observed high safety profile in animals, its affordability, and the suggestion of minimal side effects in some human case reports, fenbendazole stands out as a potential alternative option for cancer therapy that warrants further rigorous investigation. Furthermore, the relative ease of access to fenbendazole and the fact that it can be administered orally offer a less invasive treatment approach that could potentially improve patient compliance. Additionally, by its ability to specifically inhibit glycolysis in cancer cells and prevent the buildup of lactate, fenbendazole may offer advantages over other benzimidazole drugs like albendazole and mebendazole, particularly in the treatment of drug-resistant cancers, potentially making it the benzimidazole of choice in this context. Despite the numerous anecdotal accounts of success with fenbendazole and the extensive body of preclinical research conducted in laboratory settings and animal models, the use of fenbendazole for cancer treatment remains generally not suggested by conventional medical institutions and oncologists. Therefore, it is imperative that well-funded and carefully designed clinical trials are conducted to further explore the potential application of fenbendazole as an inexpensive, well-characterized, and widely available anti-cancer therapeutic in both animals and, importantly, in humans. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.